Hi, I'm Thomas Smallwood. I conducted my interview on January 27th with Dr. Matthew Hale. Dr. Hale is a doctor specializing in family medicine here at UAB, and he got his diplomas from the University of Alabama School of Medicine. He also has a subspecialty in sports medicine here at UAB. This is why he works with most, if not all, of the athletic teams here at UAB, including basketball teams. So we see him anytime we need him for illnesses, diseases, or just simply severe injury the trainer can't handle. We go and see Dr. Hale. During the interview, several different themes appeared, most of them going towards the fact that for good doctor-patient communication, the communication had to go both ways, and both parties had to respect certain rules that made the communication easier. For example, the first theme we talked about during the interview was more patient-oriented, meaning that the patients had to stay honest and open to communication with the doctor. For example, in the interview, Dr. Hale mentioned that sometimes patients just simply come in and they are dishonest or stoic. They give short answers. They just simply don't talk much, which is really not good for the doctor, because he can't really identify what the problem is to eventually give a good solution to the patient. So he identified that as being a major barrier for doctor-patient communication. The second theme that was identified during the interview is also patient-related, but this time more on the side that some patients sometimes come in with a certainty of what they need. They think they know better than the doctor. This is the first case. We'll talk about a second case later, but the first case is they think they know better than the doctor. They think they know they need, for example, aspirin, but the doctor is going to tell them that, listen, I don't think this is the best solution for what you have. I think you should take something else. And the patient is going to be reluctant to accepting that treatment because he thinks he's right and that he needs something else. So that's the first case. Dr. Hale called them hard-headed patients. They just think they know better than the healthcare professional. The second case is people who don't necessarily think they know what they need, but they know what they want. Meaning that, for example, people who are addicted to certain pain-relieving drugs would go in and maybe fake an illness to trick the doctor into prescribing them these specific pain-relieving drugs that they need. But doctors are not stupid, and usually they know when they're being tricked. So they try to maybe explain to the patient that they should be doing something better. They should try going to rehab, or maybe just give them something that's not addicting, a drug that's not addicting, and that would maybe cure them if actually they did have a health issue. So that was the second case, people who would just come in wanting some kind of medicine, not necessarily because they think it'll make them better, but simply because they think they need it. They think that they definitely want it, and they're just simply addicted. The third theme we identified during the interview was more doctor-related, doctor-oriented. I asked Dr. Hale if he followed any specific guidelines. Did he have any personal rules that he followed to enhance the chances of having good quality communication with his patients? The first thing he told me was trying to develop a trustful relationship, simply by doing very simple things like always sitting down with the patient, as opposed to standing next to the door, which would show that you're ready to go do something else instead of sitting down and giving your attention to the patient. So he told me he always sits down with the patients, communicates with them that they have his full attention. The second thing is simply looking them in the eye, showing interest in what they're saying, and this usually enhances the chances of the patient opening up to the doctor and giving him truthful information, precise information, and all the information that the doctor needs. So a lot of body language involved to help build a comfort zone for the patient so that he can open up to the doctor. This interview helped me realize that what doctors do and say during a meeting with a patient is usually thought of and not random. It made me respect more what doctors do and what they try to do when it comes to communication, at least good doctors. It also helped me realize that they're often in difficult situations, maybe with patients with really difficult personalities, and they have to maneuver around all these different personalities that come in their offices every day, and I can see that being very tiring. So at least I know it will help me in the future be more tolerant of maybe little signs of fatigue in doctors and signs that show that maybe they don't want to make a big effort of communicating, even though I think it should be part of their job. But maybe it allowed me to understand more the doctor's side of things, and enabled me to maybe change my approach to meeting doctors and being as easygoing with them as possible to make their job easier, so that they can cure me to the best of their ability, take care of me to the best of their ability. I think that's really important to enhance good doctor-patient communication.